Thank you all, and it's a pleasure to be here. As an aside, I was in graduate school in law at Columbia, and I watched this building get built. And by history, I wanted to be an architect, actually. And I remember when this slanted the area here, and I looked at it, and I said to myself, why are they building it that way? One day, I guess I'll walk into this building. And I never did until actually today, when I had an opportunity to now understand why it's slanted like it is there. So good evening. I'm delighted to be here tonight to commemorate your graduation from this esteemed university. Let me first say congratulations to all of you. You have reached the end of a long journey, and finally, EMPH from Columbia. So I applaud all of you for your work, your effort, your sacrifices that were required to achieve this goal. And I am sure that there is a spouse, a friend, a parent, a significant other, somebody saying, I lived it with him, I lived it with her. Because I know when I went back to school for graduate school, I remember some of my friends saying, we lived this with you. So it's not uncommon to know that there's a lot of support from family. So to them, all those people who have helped you out, I would say to them, ask for a nice dinner out for tonight. That would be a nice thank you. And as you know, I attended Columbia, as I just said, many years ago, and also taught at the medical school for 10 years. And given that many or most of you are in mid-career, I thought maybe I'd tell you that for me, getting my master's in law was how I solved my midlife crisis. And midlife is certainly an interesting time, and mid-career is an interesting time. But it can also be a time of turmoil. It could be one filled with questions and self-doubt. And I sort of looked about that and thought about it. I said, what am I going to do with my life? And that's one of the questions which I'm sure everyone asks, like, do I want to continue in this path? Do I want to change? Is it time to change? And I realized some people solve these crises and not know what to do by buying a red Porsche. That has been known to happen. And other options are out there as well that sometimes people pursue. And there are those who just shift gears in their career, or they decide a new path in their career. So indulge me for a moment while I share with you briefly the story of 4 people who, like those of you in the room, did just that. They changed their career, they followed their dream, and they took a new path. And they're Julia and Harland, and they're Tim and Nina. So we'll start with Julia. So as a child, she dreamed of being a novelist, but at 29, she did something way different. It was World War II, and she became a spy for the U.S. government, and she was working for the agency that would later become the CIA. And she traveled to exotic places. She was in China. She was in Sri Lanka. She relayed top-secret documents between the U.S. government officials and intelligence offices. But then she discovered that her real passion was French cooking. And so life took a drastic turn for her, and she co-authored a Mastering the Art of French Cooking book. And she had a cooking show. And for decades after, the name Julia Childs was synonymous with food and cooking. And then there was Harland. And he started his career running a Shell oil company in the South and a Shell station that sold food to weary travelers that were out there. And included in this things he sold was his special recipe that he had. And then business started to dwindle at the time, and he began putting his energies into improving his chicken dish. And he traveled around the country, and he took his special recipe with him. And then in 1952, he sold his first franchise in Utah. And more franchises started to crop up around the country. But by the time he cashed out for all of $2 million, which today would get you a very nice, small, one-bedroom apartment with a partial Central Park view, but that was in 1964. Kentucky Fried Chicken had become a household name, and Harland Sanders became Colonel Sanders, as we know him, and had 600 franchise restaurants. And then lastly, there is Tim, a corporate lawyer, together with his wife, Nina. And they attended a dinner party here in New York City in 1979, and one of the guests complained about the newspaper restaurants' reviews that they did, claiming they were very unreliable and the data was not correct. And the guests at the hotel said, at the restaurant said the same thing. They agreed. So Tim and Nina decided they would do something completely different. They would compile all the opinions of all these critics. They'd put it together. They'd survey the 200 amateur critics. They'd grade the 100 restaurants and put it all on legal paper. Tim was a lawyer. And Zagot's Guide was born. And as an aside, it's amazing, right? As an aside, about 4 or 5 years ago, I was at a dinner party, and I was talking to some people, and I asked them what they did, and the gentleman standing there was talking to me, his wife was standing next to him, and he said, well, we sort of review restaurants and see how they are and what they, whether they're good or they're not, and then we grade them. And I said, oh, you mean like the Zucker's? And they said, we are the Zucker's. So, which is exactly what happens. You never sometimes know who you're with. So Julia and Harlan, Tim and Nina, all of them were mid-career changes. And in fact, Harlan was way beyond midlife, or mid-career and midlife, because he used his first Social Security check to start Kentucky Fried Chicken. So it's unbelievable what, and he decided, well, at 65, I'm going to make a big change. So changing career paths takes courage. It takes courage to give up security and income and home and family, that, a lifestyle, and you just do it to pursue dreams, and dreams that may be uncertain and time-consuming and often very expensive. And I'm sure all of you have wondered, is it worth it? Will I fail? But here in mid-career, you might be wanting for a desperate change. And though, as I mentioned before, some may say a red Porsche would do, that may bring joy, but a more worthwhile investment is what all of you did, which is a mid-career education. And it's a chance to do some good for the world. And you in this room know what I'm talking about. You have made the commitment to change, to create change, whether it's pursuing work in completely new fields or adjusting to the one that you're in. And here you are, physicians and surgeons, university presidents, professors and hospital leaders, consultants and advocates, dedicated professionals in your respective fields who have committed yourself to a program that brings a public health perspective to your work. And it's a perspective that has the potential to alter the course of your careers and maybe the course of mankind as well. Unlike abstract science, I guess it should be humankind because it should be correct, right? Humankind as well. Unlike abstract scientific fields like physics, where big breakthroughs were made mostly by scientists early in their career, and a physicist, classmate of mine from college once said to me that if you don't make your big physics break by the time you're 30, that's it. And I remember on his 30th birthday, the first thing I did, I had on my little calendar, I said, call Chris. And I said, how are you doing? He goes, not well. And he had not made his big physics career breakthrough. And he knew, because all physicists, they may not report, they may not publish it, but they have it in their mind at that point. But great discoveries in public health took place in the middle of someone's career sometimes, after life experiences gave them the wisdom, the perspective, and the opportunity to be in the world and to see what was out there. And history teaches us that great things can come out of midlife, especially in the world of public health. So the physician John Snow, for instance, was 41 when he traced London's cholera epidemic in 1854 to a water pump on Broad Street, a pump that still stands in that same Soho neighborhood. And its discovery put an end to an epidemic that had devastated the city at that time. And recently, one of my really good friends, just was about 3-4 weeks ago, came back from a trip to London. And I said to her, how was it? She said, it was great. She said, can I show you some pictures? I said, sure. She said, let me show you my favorite. And it wasn't London's, Tower of London. It wasn't Buckingham Palace. She shows me a picture of the ground. She goes, this is where the pump was, right here. Only a public health person would say, this is my favorite picture in all of my trip to London, and also a graduate of this program, your program as well. So coincidentally, that same year, Emil von Behring, the German physiologist, was born when that happened. And he was 53 when he published a paper showing that a combination of antitoxin and toxin could prevent diphtheria, a discovery that ultimately led to the diphtheria vaccine and ended a disease that also killed millions. And here in America, there was Jonas Salk, who in 1914 was born, and at 43, in 1957, he introduced the polio vaccine that put an end to a disease which caused national terror, and according to some, surpassing our fear of atomic weapons. And perhaps if you took a survey today, I bet you if you asked people about Ebola, they would probably say that's on the top of the list, and they're not so worried about some of the other things. So I think for a moment, as great a concern as the stock market collapse or ISIS or nuclear proliferation was or is, few things create more angst than biological agents and create more worry than public health. It's always a big issue that happens. And so today, our minds can't help but gravitate, obviously, to West Africa, to Sierra Leone, to Guinea, to Liberia, where we think of public health, where the Ebola virus has obviously tragically claimed 4,000 to 5,000 lives. And the looming threat of this deadly virus has spawned fear across the globe. But this is hardly the first epidemic that has seized our our borders or immigration from other parts of, have immigrated to our country or to other parts of the world. But it also has seized our imagination in many ways. 12 years ago, we were in the grips of another crisis, which was SARS. And SARS, or severe acute respiratory syndrome, spread to 37 countries in just a matter of a few weeks and has sickened about 8,000 people. And in the early 1980s, we were struck by AIDS, an epidemic that was particularly difficult for New York State and for New York City, as it's claimed many millions of lives since that time when it began. And today, along with Ebola, we have the enterovirus 68 that has emerged after 52 years of dormancy. And that Rip Van Winkle virus has spread to 46 states and has weakened many people's lives and affected many children and has also killed about 6. And even diseases that once essentially were eradicated have made a revival performance in some parts of the world. So last spring, the World Health Organization sounded the alarm again on polio as a public health emergency of international concern. We were so close to completely eradicating this paralyzing disease and had enjoyed successes in many places that had once been devastated by polio. India once had millions of cases a year and had its last case 3 years ago. And the U.S. had its last naturally occurring case in 1979 when the disease struck the Amish community in the Midwest. But now polio has reemerged in Africa and in the Middle East with the potential to spread again around the world. And according to the World Health Organization, if unchecked, this situation could result in failure to eradicate globally one of the world's most serious vaccine-preventable diseases. But infectious diseases, as we all are very worried about those, are only one facet of public health, as you all know. It's the one that gets the attention. It's the splashy headlines, as we have seen. But nothing pulls, as we all know, nothing pulls at the heartstrings and the pocketbooks of something like a virus where there's no treatment and that can cause a lot of morbidity and mortality. But public health is also about teaching parents about the benefits of breastfeeding, about finding the tools that will stop global obesity by making preparations for disasters, either natural or made by humans. It's about encouraging men who have sex with men to use condoms, about banning e-cigarettes, or intervening when an opioid drug user doctor shops around the state or around the country. So how you define and practice public health at this juncture in your career depends on your experience and your background. For the dental profession, it may involve developing rural clinics to deliver oral health services to areas where dental care is truly lacking. For hospital executives, it might be incentives that boost flu vaccination rates among the hospital staff, or exercise programs promoting weight loss. And for pharmaceutical professionals, it perhaps is devising ways to stem the growing heroin epidemic. Or maybe in the midst of all this, there's those who are working in labs with test tubes and pipettes and PCR, doing the research that will lead to the cure for Ebola or for any of the other diseases, AIDS, or, dare we dream it, also cancer. The possibilities in public health are endless because public health is endless, from our local communities to the world at large. As the future stewards of this profession of passionate optimists, which I think everyone in public health is, you will inherit these challenges. Finding solutions demands creative thinking and chutzpah. And that's, in New York you could say that, it'd be from the Bronx. That's a word that is commonly used in my upbringing. It requires a chutzpah to seize the trials and tribulations that are out there and turn them into the opportunities to improve the world we live in. Just as John Snow did, Emil von Behring, Jonas Salk did in their day, you have the opportunity to do it today. As people in the middle of your careers, you are in the perfect place to effect the change that is needed. Think of it as a mid-career opportunity. And like Julia and Harlan and Tina and Tim and Nina, you already know how the world works, what people want, what they need, what people are willing to accept, what they're willing to do. And that's why Julia Child could shift gears from spy to chef in the middle of her life. So be the spy that finds the elusive cure to cancer. And that's why Colonel Sanders was able to perfect his fried chicken into the national sensation, even as he stood at the brink of retirement. So design the franchise that has a health food restaurant as its theme so that people don't have to go out to all the fast food restaurants that are not healthy for them. And lest we forget the Zagats, who created their guides and gave people a service they didn't even know they need. So give people services that they may not need as well that involve public health. As working professionals, you have the unique insights into the world of healthcare, health policy, nonprofit, companies, academics, and all the other fields that you come to this degree with. And these are careers that you will only build upon. Through your experience, you know how to make an impact and where your leadership skills will be needed most. Whatever you do, remember this: public health transforms lives. In fact, few things have had more impact in improving life expectancy than public health. I'm sure from the first day of public health school you were told that, maybe even before the school during orientation. Cherish that fact. Across the globe, we've eradicated smallpox, a disease that killed millions over thousands of years. In the U.S., we enacted the Clean Air Act, and that saved 22 million and prevented 250,000 premature deaths. And at this moment in New York State, we stand poised to finally end the epidemic of AIDS. And the state has taken this on. We will keep moving forward. We had a major meeting about this just 2 days ago. So today, as you receive your freshly minted degrees in public health, you have the opportunity to merge your knowledge with established careers to forge that new path, a new journey. And as Yogi Berra says, when you come to the fork in the road, take it. Julia, Harlan, Tim, and Nina all chose the culinary environment to change the world, but you're the proud servants of public health. And while Colonel Sanders continues to tempt us with his finger-licking good chicken, by the way, one piece also has about 400 calories and 28 grams of fat, so I probably wouldn't eat that, you'll be looking for ways to stem the epidemics of diabetes and obesity. You'll be searching for ways to cure the latest infectious diseases, improving the lives of people in our communities and in communities around the world. It is a noble mission and well worth the effort. And as I close, I will let you know about a trip that I once took to a village about 150 miles from Maputo, Mozambique. It was in an AIDS clinic, and when I noticed all the medicines and how well stocked the clinic was, I asked the person who ran the clinic, how is this that your clinic is so well prepared and some of the others aren't? And unbeknownst to me, a nurse chimed up and said, because of Columbia University's public health school in New York City and Alan Rosenfeld, who was a dean of the school before the present dean, for they make sure we have what we need. So I just leave you knowing that the school touches so many different people in so many parts of the world. And I leave you with my favorite quote, the quote that gets put on my desk every time I move, and I've moved a lot over the years. Before I put anything else out, I put out this quote. It's from Margaret Mead, and it says, "Don't underestimate the power of a few people to change the world. That's all that ever has." So congratulations, and may you change the world, each and every one of you, as you move forth and take on your public health degree and solve all the problems, and save many people around the world. Thank you.